will have known, because of the real drama in our politics this week and in our court system, we've been focusing on that, the situation around former President Jacob Zuma. Unfortunately, though, the lived reality of so many South Africans is still very dire. We've seen what's happened because of poverty, racialized inequality, and then the economic impact of the lockdown becoming more and more stark. There is a new NIDS Cram survey that's found around 500,000 children, an extra 500,000 children, have dropped out of school in the last year. In other words, to put it another way, that it's the highest number of children to drop out of school in 20 years. You're surprised, you're shocked. Listen to this. Nearly 3 million children live in a home which has been affected by hunger. That's one of the findings of this survey. It was conducted between April and May this year. The person who puts these together, along with a big team of academics, is Professor Nick Spall. He's an associate professor in the Department of Economics at the University of Stellenbosch. Professor Spall, I do appreciate the time. Good afternoon to you. These figures are frightening. We should start with the numbers around hunger. We're seeing so many people who don't have enough food, and so many of them are children.
Definitely, and thanks for having me, Stephen. So one of the survey findings was that in April and May, 10 million South Africans were living in households where the respondents said that someone had gone hungry in the last 7 days, and 3 million children were living in households where a child went hungry in the last 7 days. So 10 million South Africans means 1 in 6 South Africans that's experiencing weekly hunger in April and May this year.
Do we know how much of that is to do with the lockdown, or how many people would have been hungry, and particularly children would have been hungry anyway because of our economy at the moment?
So there's some uncertainty around it. We know that it's at least double what the rates were of child hunger before the pandemic. But the exact severity of it now compared to before the pandemic is difficult to tell. And the reason is that the reference period that we ask about is in the previous 7 days, whereas other surveys like the General Household Survey ask about the previous year. And so the reference period is much more severe now. So the rates of hunger are much more intense than previously, but it's basically about the reference period.
I mean, what this tells us, it's not about the supply of food. We know that the farmers are able to produce enough food. It goes through the system. This is a problem where people just don't have enough money to buy food. The problem rests right there. It's with the income that people receive. It's not enough.
Definitely. I mean, the experiencing hunger, we must remember that that's literally just not enough money to buy food to put into your stomach. It says nothing of the nutritious value of the food that you're eating. So the survey also asked respondents whether or not their household had run out of money to buy food in the month of March, which was the month preceding the survey. And what we found was that 35% of respondents, so a third of South Africans, said that their household had run out of money to buy food in the month of March. And that obviously has implications for buying any kind of food, but particularly for buying nutritious food. And that's got long-term implications for things like stunting, developmental delays for pregnant women and their young children. These are really severe long-term consequences that we're likely to experience as a result of the pandemic, the lockdowns, and the stress that families are facing.
There's actually court action from 2 organizations. We're going to speak to them in a moment around school meals. But I mean, this society, it was an important decision that this society made to provide school meals for children. And many children are not getting them. The research that you've put together suggests, it shows you how important those meals are.
Most definitely. I mean, 2 things on the school feeding. The one is we do know that there's been an improvement in the receipt of school meals from around 49% in November to 56% in April. But that's still well below the 65% and higher in some provinces. That was the pre-pandemic level. But another finding that is particularly worrying is if we think about mental health, 40% of adults living with children in food-insecure households, so those are ones that ran out of money to buy food, show signs of depressed mood. In other words, they're screening positive for depressive symptoms. And this rises to 51% if you take into account the fact that a child in the household did not have access to a school meal. So the lack of access to food, particularly for children in the household and particularly for those that don't have access to a school meal, is really severely negatively affecting the mental health of caregivers.
I would imagine it affects women far more than it affects men. I think it's something like, 38% of children actually live with their fathers.
Most definitely. I mean, one of the other findings that we see is that women were more likely to shield children than men. So we see shielding where the rates of reported household hunger are higher than the rates of reported child hunger. So where 17% of respondents said that someone in their household had gone hungry in the past 7 days, only 14% said that a child had gone hungry in the last 7 days. And we see that those rates of shielding children from hunger are much higher for women respondents, for female respondents than for male respondents. So yeah, I think it's true what you're saying, that it does seem to be that women are taking the brunt of this. We also know that from the employment perspective, women's employment is 8% lower in March of this year compared to the beginning of the pandemic. And they're also much less likely to have received the government relief efforts like the SRD grant or the UIF TERS grant. There were only 35% of the beneficiaries were women.
Just to be clear what we're talking about, Nick, and I want to make sure I've understood this concept correctly. When we talk about shielding a child, we're talking about, in this case, primarily a woman with food on a plate, feeling hungry herself. It's in the evening, maybe hasn't had breakfast, maybe hasn't been able to have lunch, and instead of eating that food herself, giving it to the hungry child next to her and going to bed hungry herself.
So, Stephen, I mean, we can't get that level of detail. I think that you might be coloring in the picture and possibly very accurately. But what we do know is we ask the respondent, has anyone in your household gone hungry in the last 7 days? If they respond yes, or if they respond no, we also ask a follow-up question. If they have children in the household, did a child go hungry? So yes, what we're seeing is that in households that are where the woman is the respondent, they are more likely to express that they are going hungry or that an adult in the household is going hungry, but not that a child is going hungry. So that's what we mean by shielding. And I think what you've described is probably the likely reality in many South African households.
Sure. Very, very sobering. The number of children going to school has dropped dramatically. Now, we're still in a position where most children aren't going to school at all at the moment, right now, because of the sort of school holidays which were extended. But even before the holidays, most children only going to school every second day, every second week. As a result, we're seeing a huge level of dropout. Is it going to be possible to get them back?
Sure. So one of the questions that we asked households where there were school-going children or children of school-going age was whether or not a child that was aged 7 to 17 years had returned to school since the beginning of this year. And what we found was that approximately the equivalent of about 750,000 children had not attended school since the beginning of this year, whereas the pre-pandemic level for the same statistic is approximately 250,000. So that means that there's an extra 500,000 children that have potentially dropped out of school during the pandemic. This is triple the rates of normal dropout. And I think that the important thing there is we don't actually know if those children might drop back into the system later. They might come back to school in term 3 or term 4. But what we do know is that the longer they stay out of the schooling system, the higher the chance of their dropout being permanent.
There's been an announcement today from the acting health minister, Mameloko Kubai, about vaccinations. Now, there are a couple of things. One of them is around the age of the people who could get vaccinated. People between the age of 35 and 49 can now get vaccinated. I think that might include you, Professor. I'm not sure, but it certainly includes me. At the same time, there's been quite a lot of criticism about the fact that over weekends we've seen very few people getting vaccinated. It seemed government sector sites really not vaccinating everyone. Now, from the beginning of August, that's going to change. But there must be a huge cost to this decision not to do vaccinations on weekends. It makes more people vulnerable to the virus for longer.
Most definitely. I mean, this was one of the most insane decisions of the government, is not to be administering vaccines on weekends. Just to give you a sense, I mean, we administered 163,000 doses on Tuesday this week. And on Sunday, the most recent Sunday that's just gone past, we administered 6,000 doses. And that's because we don't operate public vaccinations on Saturdays or Sundays, because allegedly, according to the department, we can't pay the overtime of the staff. So the Treasury officials could not communicate with the health officials effectively, despite this money being made available in February. And because of that, 1.3 million fewer vaccines have been administered by the end of June. If we had been vaccinating on Saturdays and Sundays in May and June of this year, 1.3 million more people would have a jab in their arm. And the announcement that was made about vaccinations happening on weekend, while it's extremely welcome, and I'm going to have a good weekend because of that, it does also only kick in from the 1st of August. Or the 10th of August. I can't remember what the announcement was, but the point is we still have the rest of July where we're not using weekends, despite the fact that we have more than 7 million vaccine doses in our borders, and we've only vaccinated just over 3.5 million people.
I mean, there's no way that it makes sense. I mean, from an economic basis, if we're going to be cold economists, dismal scientists for a moment, the cost of treating someone with severe symptoms of COVID-19 is so much higher than paying someone to work on a weekend to conduct vaccinations.
I mean, completely, Stephen, but I mean, that's a very small cost, actually, relative to the societal cost think of the level 4 lockdown, the hunger, the job losses, the disruptions to the schooling system, the entire kind of grinding to a halt of the South African economy while we're trying to tackle this pandemic. And yet we know there is only one route out of this drama that we find ourselves in, and that is vaccination.
Professor, there's another big conversation going on around social grants at the moment. I'm not talking about a basic income grant, but people who are suffering economically, about whether or not TERS payments should be reinstated. There seems to be some movement, but again, it comes a long time after people have lost income because they can't work. Imagine being a waiter, for example. You just aren't able to work at the moment. Your place of employment, the restaurant you work in, is shut, and shut completely. There's no money going through that business, really. Certainly not for a waiter, maybe for the chef. And do you think that sort of reinstating a social grant, a TERS grant, would make a big difference in these times?
I do. I mean, I don't think necessarily that it's the TERS grant that should be reinstated rather than the 350 Rand social relief of distress grant, which was targeting unemployed people. Because I think that if you're looking at the destitute groups in society, it's those that actually don't have employment, rather than those that have intermittent employment who are also destitute, but not as worse off as those that were reliant on that 350 Rand social relief of distress grant, which, as we know, has expired at the end of April. So the rates of hunger that we're talking about here, 10 million South Africans living in households affected by hunger, this was before the removal of that grant. So I think the rates of hunger are likely to go up. And I think you're completely right in saying that in a middle-income country with hunger that is as prevalent as it is, we really should be considering things like a basic income grant, or in the absence of that, extending the child support grant or the social relief of distress grant.
Dr. Nick Spall, Associate Professor in the Economics Department at the University of Stellenbosch. Really sobering conversation, really important conversation. Thank you for your time. Thank you for the research that you and your team, it's a big team, have been able to put together. Really gives you a picture of what's happening in our country at the moment, and the lived experience of so many people. The idea of shielding children from hunger, doesn't it just actually break your heart? All right.